Hello guys, welcome back to my YouTube channel Dr.R.K. In this video, we will talk about the muscle of mastication. Muscle of mastication is very important from point of view of university examination as well as clinically. So continue to watch my video at last and never skip this video. If you are new at my YouTube channel, then please subscribe, like and share my YouTube channel and never forget to press the bell icon so that you will get notification of all video uploaded by me on my YouTube channel. Let's start this video without escaping the time. Now we will talk about the muscle of mastication. And first is the superficial part of the masseter muscle. As you can see here clearly that the superficial part of the masseter muscle arises from the anterior two-thirds of the lower border of the zygomatic arc and adjoining zygomatic process of maxilla. And the fiber of the superficial part of the masseteric muscle passes downward and backward at 45 degree and get inserted into the lower part of the lateral surface of ramus of mandible, and it is supplied by the massetic nerve, and the massetic nerve is a branch of anterior division of mandibular nerve. And now we will talk about the deep part of the masseteric muscle. As you can see here clearly that the deep part of the masseter muscle arises from the deep surface of zygomatic arc, and the fiber of the deep part of the masseter muscle passes vertically downward and get inserted into the rest of the ramus of the mandible, and it is also supplied by the masseteric nerve, and which is a branch of the anterior division of mandibular nerve. Now we will talk about the temporalis muscle. As you can see here clearly that this is a temporalis muscle and which arises from the temporal fossa excluding the zygomatic bone and temporal fossa. And the fiber of temporalis muscle runs vertically, middle obliquely, and posterior horizontally, and all converge and pass through the gap deep to the zygomatic arc and get inserted into the margin and deep surface of coronoid process and anterior border of the ramus of mandible, and it is supplied by the two deep temporal branch and anterior division of the mandibular nerve. Superior head of the lateral thyroid muscle. As you can see here clearly that this is a superior head of lateral thyroid muscle, and which arises from the infratemporal surface of the crest of greater wings of sphenoid, and the fiber of the superior head of the lateral thyroid muscle runs backward and laterally and converges for insertion and get inserted into the pterygoid fovea on the anterior surface of the neck of mandible. And now we will talk about the inferior head of the lateral thyroid muscle. As you can see here clearly that this is the inferior head of the lateral thyroid muscle, and it rises from the lateral surface of the lateral thyroid plate, and origin is medial to the insertion, and the fiber of the inferior head of the lateral thyroid muscle runs backward laterally and converges for the insertion, and it inserted on the anterior margin of the articular disc and capsule of the temporal mandibular joint, and insertion is posterior lateral and at a slightly higher level than the origin, and it is supplied by the branch from the anterior division of mandibular nerve. And now we will talk about the superficial head of the middle pterygoid muscle. As you can see here clearly that the superficial head of the middle pterygoid muscle arises from the tuberosity of the maxilla and adjoining bone, and the fiber runs downward, backward and laterally and get inserted into the rough area on the medial surface of the angle and adjoining the ramus of the mandible below the behind the mandibular foramina and the mylohad groove, and the deep head of the medial pterygoid muscle. As you can see here clearly that arises from the medial surface of the lateral pterygoid plate and adjoining process of the palatine bone, and the fiber runs downward, backward and laterally two head get embrace part of the lower head of the lateral pterygoid and get inserted into the rough area on the medial surface of the angle and joining ramus of the mandible, and below and behind the mandibular foramen and mylohad groove. It is supplied by the nerve to the middle pterygoid and branch of the main trunk of the mandibular nerve.